Well, this week marks Black Maternal Health Week, and it's a time to highlight America's Black maternal health crisis.
That's because Black women are 3 to 4 times more likely to die in childbirth. Cincle Esamoah brings us the story of one man turning his pain to paintings in an effort to raise awareness.
Lining the halls of Capitol Hill are portraits honoring Black women who have died in childbirth.
These aren't just numbers that we're just throwing out there. These are actual women who are passing away, who are not with their families, who are not able to raise their children.
You're putting a face to them.
Exactly.
These paintings are part of Omari Maynard's life work, spurred by his wife's death. His partner, Shamony Gibson, dying days after childbirth in 2019 due to postpartum complications.
She was healthy, she was good, we were ready. And as soon as her water broke and it was time for us to deliver our baby, things just shifted. But a couple of days after, Shamony started complaining about chest pain, shortness of breath, all the issues that were symptoms and signs of a pulmonary embolism.
Maynard says doctors dismissed her symptoms. Now, instead of raising their children together, he's caring for their 8-year-old daughter and 5-year-old son without her.
Before Shamony passed, I did know about, the Black maternal health epidemic.
You were familiar.
I was familiar, but I also never thought I'd be on this side of the coin. I never felt pain that way. It was a pain that I didn't have language for, so I started painting.
These paintings reflect the scope of the Black maternal mortality crisis in the United States. While overall U.S. maternal mortality rates have fallen below pre-pandemic levels, Black women continue dying at a rate nearly 3.5 times higher than white women around the time of childbirth. And some healthcare providers warn recent changes to the U.S. healthcare system could compound the problem. Earlier this month, the Trump administration began firing thousands of Health and Human Services employees and withheld millions of dollars from family planning services, freezing Title X funds for at least 16 fund grantees, including Converge clinics.
There are many services beyond birth control that Title X provides, and cervical cancer screening and STI prevention and treatment are two of the other core services.
Are you at risk of having clinics shutter entirely?
Yes. Yeah.
Converge operates more than 100 healthcare clinics across Mississippi and Tennessee, the 2 states with the worst maternal mortality rates in the United States. In a letter from the Department of Health and Human Services, the agency said in part it's reviewing whether recipients of Title X funding are in compliance with recent executive orders, including the review of materials pertaining to addressing systemic racism.
The prospect of Title X services going away entirely in these states will only serve to increase the number of women who are at serious risk of maternal mortality.
HHS did not immediately respond to NBC News for comment. As healthcare providers wait for answers on their funding, Maynard hopes his paintings will raise awareness for lawmakers and the country. Each woman's portrait placed in front of the office of a representative of her state as part of the In Her Honor exhibit.
What impact do you hope this has?
For people to see that these are not just numbers, that these are real women, these are real pillars in their own community. And if we can create a system where things can shift, we'll be better off as a society.